कला प्रदर्शिनी 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 कला प्रदर्शिनी
तत्तुम 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 तत्तुम
कला प्रदर्शिनी.
Namaskaram. Good evening to all our viewers today, and welcome back to the Earth series, Candid with the Ghantasalas. Today we have a very eminent pioneer in the field of medical research and practice. It is none other than Dr. Ananthakrishnan Sivaraman, who is a consultant urologist, uro-oncologist, and robotic surgeon at the Chennai Urology and Robotics Institute. He specializes in minimally invasive robotic surgery and uro-oncology, and is a national proctor of the robotic surgery in India, running a fellowship program for robotics, as well as one of the few robotic surgeons in the world to have performed a robotic renal transplant surgery. And he has several publications which are peer-reviewed in journals and served as a managing editor for the Journal of Robotic Surgery as well. He has authored several books and is also the faculty of the University College London Robotic Centre for the Advanced Urological Robotic course, as well as the faculty of the Society of Robotic Surgery. Dr. Ananthakrishnan is the founder director of the Indian Prostate Cancer Foundation, an organization dedicated to the alleviation of suffering from prostate cancer in India. Today, we are going to be delving into several such topics of robotic surgery, prostate cancer, and many more, along with Dr. Ananthakrishnan Sivaraman. And we are very happy to have you with us, sir, today. Welcome to our show.
Thank you. Thank you very much for this opportunity. It's a pleasure to be on your show. Thank you. Am I audible enough?
Yes, sir. You are.
All right. Good evening. Good evening. And I've been hearing a lot about the work that you've been doing. So it's a pleasure to be on the show. Thank you.
Thank you, Doctor. Thank you very much for being with us. We are curating Earth series to motivate from anxiety and stress, and we are very happy to be with you today. Robotic surgery, it sounds like science fiction, and how far are we from reality? Can you explain?
So I get asked this question a lot of times by a lot of people, especially patients who come into us. It's actually robotic surgery is not new. The first robotic surgery was done in the year 2000, and now we are in 2020. So it's been about 20 years since the first surgery started. So whenever we talk about robot and robotic surgery, especially in Tamil Nadu, everybody talks about this movie, Rajinikanth movie, Endiran, the robot. So everybody talks about that sort of thing, but it really is not something that can happen on its own. So even though when we think of it, it's like it operates on its own and stuff like that. Currently, as it stands, robotic surgery means a master-slave mechanism, which means whatever the surgeon does gets translated inside the patient's body. So the robot cannot do anything on its own. So number one, people have to understand it's something that the surgeon does. Though it's called robotic surgery, the main goal of this robotic surgery is it's somewhat similar to laparoscopy, but it's probably 100 times more advanced. So tiny incisions are made, and then tiny instruments are put inside the patient's abdomen. And when we operate outside, it gets translated inside. So we don't have to put our hands inside. So, which means the incisions are much smaller. And because small incisions, the pain is very, very minimal when we do the surgery, and patients get up and start walking in about 4 to 6 hours after surgery, and they can go home in 24 hours after surgery. So again, a massive advance compared to open surgery, and further advance when you compare it to laparoscopic surgery. And it's not new. In India, we've got 70 robots now. But I'll give you another example. For America, for 330 million people, has got more than 4,000 robots. India, for 1,000 or 1.3 billion people, we've got only 70 robots. I think there's a long way for us to go. But because the technology is slightly more expensive, India is a bit slow to catch up. But eventually, I think it will be there in most parts of India, and a lot of people are going to benefit from it. So my work, especially, is dealing with uro-oncology, which means cancer related to the kidney, bladder, prostate, and so on. And this robotic surgery is fantastic surgery to perform for prostate cancer, especially. So again, I'm straight away gone into a lot of technical stuff. I'm sorry for doing that. So
No
robotics,
problem, doctor. I think
robotics,
you took us in the. Go ahead. Sorry.
it's basically an interface between the surgeon and the patient. So what we do outside happens inside. I'm sure a lot of your viewers are interested in what we're going to show. That I would direct them to our Curie Hospital website. It's got a lot of data about robotic surgery and some videos as well. You're more than welcome to see that.
Sure. And you actually pointed us in the next question that we already had. Just based on our research, like we were looking at the surgical robotics in India growth, there were several publications, and one of it was each device costs like 1.5 million US dollars.
Yeah.
And the cost of running each device is also, each treatment is more expensive. So the more surgeries through robotics, it reduces the cost per surgery as well. But is this something that, as an individual person, there's only so much you can do? But is there any initiative by the government to promote robotics, to promote doctors who specialize in robotics, so that the reach can go to the masses?
Yeah, that's a wonderful question, and thank you for asking that. So, number one is, when you look at a country like ours, India, we're not a very rich country. We don't come under the rich country category, and we're still considered a developing country, and we're progressing towards those goals. So, when you look at a country like ours, the government probably is focusing more on basic needs of the people. So, for instance, if so many people have the need for robotic surgery, so the umpteen number of more people would need basic surgery. So, that at present the government's undertaking a two-pronged approach. A lot of initiative on the basic surgical side, and then they're trying to focus on specialized centers. That's one of the goals that the government has brought in, where all India institutes are being created all around with access to robotic surgery and so on. So again, any country just can't focus on one part of it, but for a country like ours, it's going to be difficult to focus on robotic surgery, and that's where the private sector has come in a big way. So if you look at the robots in India, most of it is in the private sector. And biggest limitation, as far as I can see, is buying the robot is not a big problem. A lot of the corporates can afford the robot, but training a surgeon to be a robotic surgeon is a problem. So, for instance, I had to go to the US to get myself trained. I spent quite a bit of time there, and then came back to India. But we don't have that number of fellowships running at the moment in India. So even, we've got 70 robots, but we don't have 70 fellowships running where people can get trained in robotic surgery. So that's a big problem. So we've got a lot of self-taught robotic surgeons, and a lot of times, the time it takes for a surgeon to be a competent robotic surgeon is going to take a long time, unless they are fellowship trained, where actively they train every day in robotic surgery, and then they go back to practicing. So, good question. We need a lot of training centers for robotics.
Doctor, I don't know if you had a look at our questions or not, but you're again asking us the next question that we had. Several doctors like you, so several young doctors are going abroad to get trained in robotics and stuff like that. But one of the problems that, again, another research paper came up was, you do have a lot of doctors taking up robotics abroad, but not many of those doctors are coming back to India to actually practice this here. And that's exactly what you also brought up, that like, yeah, we do have 70 robots in India itself, but you don't have that many doctors. What is the underlying thing? Is it just the opportunities, or is it the awareness?
I don't know why. So you're asking why surgeons who train abroad aren't coming back, isn't it? So
Yes, when it's still so booming here, like the growth opportunity is so big in India, where you have only 70 robots, while the US has so many thousands of robots. At least the growth opportunity should be enticing, right?
I think it's a no-brainer. People should come back to India to get after they get trained and practice their trades here. To be honest, because we have 1.3 billion people and we're booming right now. So India is the place to be. Whatever people might say, initially the life is good there, and when you go there, the training is good. I won't deny that. In fact, one of the best places to train would be America right now, because the volume in robotic surgery, especially, is exceptionally good there. So I trained in an institution that would do 1,000 robotic surgeries per year, and there's no institution in India that does that number at present. So again, the volume of training is fantastic there. But I wouldn't be able to say why a lot of people aren't coming back. They should. That's the honest answer. Because India right now, I think we're about 10 years behind where the US is right now in a lot of things. But our growth potential is far higher. We just have to look at our country's growth over the years compared to the Western world. I think India is going to be an amazingly fantastic place to practice in another 10 years. Even now, it is a very good place to practice. But certain organizational difficulties, infrastructural difficulties, if I may put it like that, are bound to be here. Number one is the insurance in India doesn't cover robotic surgery at present, but the government's made a huge effort in this to make all insurance companies accept robotic surgery, so that by next year, I think most of the insurance companies would accept robotic surgery, and that in turn would make a lot more hospitals buy the robot, because there's a definite advantage when you compare it with open surgery, when you compare it with the laparoscopic surgery, and for certain cancers, when you compare it with the radiation, robotic surgery is far better. So I think it's a no-brainer. In a matter of a few years, there's going to be a huge boom in India. And trust me on this, a lot of doctors are going to come back here to India as well.
Very nice. You brought something wonderful to India. You would have faced roadblocks. How did you overcome the stress and anxiety while you were doing all this? Definitely, it's a great stress for you.
I honestly, in terms of stress, the biggest stress that we as doctors face sometimes, especially when you're working in oncology, which is a cancer-related field, is sometimes when you have to give less than perfect news to the patient regarding their cancer, regarding their prognosis. That causes a lot of heartache to us, because we always empathize with the patients, and when they're faced with not so perfect news about prognosis and so on, that causes a little bit of stress. But otherwise, work-wise, seeing patients every day, I think it's actually a stress buster, if you ask me. Yeah. Really enjoy doing what I do, and then every day in the hospital is like, how do I put it? There's some point in time where you really want to. You. In fact, my father's a doctor as well. So in these Corona times, I had asked him to stay at home. He's 74 years old. And I told him, Appa, why don't you stay home? And he said, so you can stay at home. Because over a period of time, we really enjoy going to work every day and then seeing patients and then sharing in their experiences and helping them out. It really makes a difference. I would call it a stress buster, not really a stressful period. But to answer your questions, we have had to jump through several hoops to come to where we are at present. And we probably need to take it as part of our life experiences. I wouldn't call it specifically stressful. There are certain periods when it was stressful, for instance, moving from here to a new country and then setting up house there, family there, and so on. It was a good experience, but we had to adapt and adjust. So I think whenever we're faced with some change, there's a little bit of stress that creeps in. But other than that, I think we've been pretty okay.
So you have evolved as a medical student, surgeon, consultant, urologist, and now as a director. How was your journey? And tell us about Curie Hospital also.
Yeah. So that's like my life history in one single question. But anyway, my family of doctors. My father and mother were both doctors. My grandfather is Dr. P.R. Balakrishnan, and he was also a doctor. He was a surgeon, and he was also dean of Madras Medical College. So, and both my father and mother studied in Madras Medical College, Dr. Sivaraman and Dr. Manamalli. And so throughout my schooling, it was just like this, you have to become a doctor. So I probably didn't have a choice, I think. But to be honest, I didn't personally prefer to go into any other field other than this, because every day and in the dining table you would get, my father continuously is capable of talking continuously. So he would every day come back home and tell, this happened in hospital, this happened in hospital. So we always grew up with this, you need to go and do that. Huh? So my schooling was in Don Bosco, and focused. And those days, these days, my daughter at 12th standard knew what she wanted to do. She said, "Appa, I want to do economics," and then she chose economics, and she's studying in Warwick University in the UK. But those days, I didn't have that big of an idea that I should become an engineer or an economist or a lawyer or something like that. The medicine seemed to be the most logical path, and I chose it. And I'm absolutely happy with that decision. And a lot of that came from my mother. From a very young age, she would say, "There's this, you have to become a surgeon. You have to become like your father." And actually, when I was younger, she wanted me to become a cardiothoracic surgeon. In those days, that used to be within the surgical field, that used to be one of the top fields. So she always said, "Anant, you have to be a cardiothoracic surgeon," and so on. So anyway, 12th standard was like those. Nowadays people are talking about NEET so much. Those days also it was tough, but it was. I think my mother was hugely instrumental in me becoming a doctor. And I was too playful at that age. I had no idea. I would. If she let me for a minute, I would run out and start playing. So, but for her, I probably would have been goat herding or something somewhere. So, so she made me a doctor. She would every day. In fact, I remember those days. She probably took about 6 months off from her work. She was a professor of biochemistry in Madras Medical College. She took time off from her work and then made me a doctor. So I joined Madras Medical in 1992. And I must say it was a fantastic college. Madras Medical, to be honest, was exceptionally good those days. Even now, I think it's an amazing place to be. And life was exceptionally good. So about 5 of our classmates from Don Bosco joined Madras Medical College. So we were friends from kindergarten to final year MBBS. And they're all doing amazingly well at this point in time. And then once we finished college again, it became a big. Please, madam, you wanted to ask something? Yes.
There is a question for you. There is a question for you, whether you are studious or playful, by Shiva Chidambaram.
Yes. Srigai Chidambaram sir is asking that question. Yeah, so he knows me when I was in medical college and when I was doing my MCH in urology in Madras Medical. So he was he was our assistant professor at that time when I was a student, and then we had such a nice person to work with. But anyway, so he's asked a specific question: was I playful or studious? So, in once you join medical school, I think whether you're playful or whether you're studious, what needs to be done at that point in time was always done. So there's no question about being too too playful and not studying. And once you're in medical college, so so again, medical college was just was a whirlwind. The 5 years we didn't know what happened. One day we joined first year MBBS, and then anatomy was there, new classmates and new friends, and so on. And then finally, at the end of 5 years, it just went off like a whirlwind. And there's no question of there's a huge amount of information that we had to process. It was a I would rate it as one of the most enjoyable periods of my life. So studying in medical college, new friends, and amazingly good amount of information. And what they taught us more than anything else was, because we were in a government hospital, all kinds of people would come to us, and we had to empathize with each and every one of them regarding their problems and so on. You can't just see a patient as a patient with some clinical signs and symptoms. So there's so many important things that we would learn. I remember one professor saying, we were probably when I was a house surgeon, I addressed a patient, sir, that patient with chest pain. And then he was very cross with me. He said, Anand, it's not a patient with chest pain. That's not his name. He is Mr. Dorai. He's got a wife. He's got a child. He's got 2 children, and you should address him, because if you just address him based on his clinical condition, you won't learn to empathize with his personal situation. So there's so many things that were inculcated in us in that college. I'm eternally grateful for what I've learned, and this has stood a long way in our life as well. So every day when we see patients, it's not just looking at them as what is the problem, but we have to look at them as a family, what they're going through, what sort of stress they're having, and so on. So that, I think, is probably something that it just automatically comes when you go through the gates of MMC. Probably a lot of other medical colleges as well, but this is something that sticks with us. And then general surgery. After finishing medical college, then there was again a big question whether you want to do surgery or medicine or something like that. So I had an opportunity to go to the US at that time, because my Parima Paiyan, my Anandan, my Perima's son had gone to the US. So he was he called me there and said he's already joined. He's 1 year senior to me in Madras Medical, and then so he said just come over, and then we'll be okay. So I had half a mind to go there, but my mother said you're better off. You should probably stay in India. She didn't let me go. I was a bit cross with her at that point in time, but it all worked. I joined surgery here again in Chennai, and then finished surgery. And then once I finished surgery, again there's this big question mark: what specialization should we do? Whether it's urology or plastic surgery. By that time I was married. My father-in-law was a plastic surgeon. My father is a urologist. So both of them are saying, one father-in-law said take plastic surgery, father said take urology. So again, there's big difficulty at that point in time. So these are probably some things that I had to share. So those days we had entrance exams, and I wrote the entrance exam for urology. So urology had 3 seats in the open category, and then plastic surgery had much more higher number of seats. So I came 4th rank in urology. So I didn't get urology, but I got plastic surgery. So, and then so and plastic surgery again. Even though I got it, because I didn't get urology, I thought I should study for 1 more year and then get urology. So again, he probably my father-in-law is a fantastic man. So they're running a hospital in Coimbatore called Ganga Hospital. So and he's one of the persons that I look up to as well. Somehow I preferred urology rather than plastic surgery. But one of the other things that I forgot to mention was, you asked about Madras Medical after joining first year. You know who my professor of biochemistry at that time was? My mother. Hmm? So my first year teacher in
Great.
biochemistry was my mother. So it was such a nice feeling. So I usually used to sit somewhere in the middle to the last row, but when her class came, I would come to the front row. Okay. And when I joined Madras Medical College again for urology, MCH in urology, next year again I got through entrance exams. My father was my professor in urology. So mother and first year and father in MCH. So probably a very, very, very lucky guy in that aspect.
Very strong
And
foundation.
yeah, I must say so. So he'd already. So my father is again a hugely important person in my life because I've modeled my career, the way I think, the way I see patients. A lot of what he does is what I'm doing right now. So my sister often calls me as a pale imitation of my father. So you probably would have been better off asking him to give you this interview. But anyway, so he was
Great.
my teacher, and then once we finished urology, he'd already gone to the UK when he was young, and then I was also in the UK for some time with him. So UK seemed a natural, logical progression. So I went after finishing my MCH in urology. I went to the UK, and then studied in the University College London, and passed FRCS urology. So at that time, 2006, it was 2006, 7, went to a conference in Glasgow in the UK, and then they kept the surgical robot there, the Da Vinci robot. So for everybody to sit and see how it works and so on. So that was my first time on the surgical robot. So, and it was amazing, that experience sitting on the robot and things. So I decided there and then to study robotic surgery. But unfortunately, in England, the options were limited to study robotic surgery. So I had to go to America to study robotic surgery, and then for that we had to write exams to pass the American, America had these USMLE exams at those times. So I was pretty old at that time, 31 or 32, I think. And for me to study what I studied back in MBBS was probably very, very difficult thing to do. But because I wanted to learn robotics, I really made an effort and got a fellowship there and went off to the US. So how have I grown? So the pathway was kind of, other than studying, I didn't have any, studying and passing exams, and the exams were a bit stressful and so on. Nothing major. The pathway was okay. But when I had to go to the US and all, again, studying basics and all was a bit difficult. But the most important challenge came when I came back to India. So you studied well, you had a skill set that very few people in India had. But when you came back, translating that into practice was altogether different ballgame. Nobody would come to me because just because I got robotic surgery there, or so. Again, that was a lesson that I learned very quickly. So as soon as I came back, I thought, because you studied so well, you got so trained well, patients would come flocking. But actually, no, that wasn't the case. I was joined Apollo Hospitals then. I was heading their robotic surgery program, but I had to spend a lot of time and effort to make people understand what robotic surgery is. A lot of people would come in, and then when I said something about robotic surgery, they said, "Vana sir, நாங்க நாங்க routine பார்த்துக்கிறோம் அப்படின்னு போயிடுவாங்க." So that was something that we had to fight. That was one of the biggest challenges, making people understand what robotics is and how the outcomes are and so on. And what I found was doctors came to us first because they could understand the advantages of robotic surgery. So the first few patients that I operated here in Chennai were doctors themselves. So once the doctors came in, slowly patients started coming in, and this is what made a huge difference. So patients became advocates of robotic surgery, and then word of mouth, and then we had a lot of help from the corporate sector as well. So people got to know what robotic surgery is, and that made a huge difference. So suddenly our numbers, the first year was, I was even, like you asked me, why did when you came back, was it easy? And so very difficult. The first year I had several doubts in my mind. Did we come back? Was it a mistake? Because I was working there every day, and then when I came back the first year, I didn't have a lot of practice. And a lot of people didn't know what I was doing. So I was doing general urology, not specifically robotic surgery or uro-oncology. People didn't realize that this was there, available, and it was expensive technology. So again, that was a big trouble. But then we got through that, and once it picked up, we wanted to start a hospital that could allow the surgery to be accessed by a lot of people. So, and one of my strong beliefs, especially, because my father-in-law has a similar model in Ganga Hospital in Coimbatore, which means that we shouldn't turn away anybody who comes to us for help in terms of surgery or something like that. So the best way to achieve that would be to start a center of excellence and to scale up volumes. So with volumes comes efficiency, comes our ability to vary our costs based on the patient's needs. So that was one of the main goals of starting this Chennai Urology and Robotic Institute. And it's been 2 years since we started. So we're also a fledgling hospital, and hopefully we'll go from strength to strength. I'm probably rambling for a lot of time. Sorry to.
No, I think we're getting a lot of good comments.
No.
People are actually
Very
enjoying.
very interesting.
Yeah, people are enjoying what you're saying. We're getting a lot of comments as well. Doctor, one of the key questions that we've typically heard, like people have heard of a oncologist, people have heard of a cardiologist, people have heard of a pediatrician, but urologist, it's not very common. Like, and in the Indian context, people are very shy, so they're never going to think of a urologist in the first instance. And we have a lot of friends, relatives who had infections and stuff, and they're still very shy to go. Can you give some tips as to when someone has a problem, how do they identify, like, okay, especially from a urologist, which is like, I wouldn't say neglected, but less thought of from a public perspective. What are the symptoms that people should be aware of and think, I should think of a urologist?
A very nice question, but when you say less thought of, it gives me some chest pain. But
so, like people at least cardiologist is like the first, like anybody has, this is the heart problem.
I get the point of it. So number one is who is a urologist? So so the body has the kidneys. The main job of the kidneys is to take away bad products from the body and push it out through the urine. So the kidneys, then the bladder is a storehouse of the receptacle where the urine is stored, and then urine comes out through via the prostate. The pathway is covered by the prostate and the urethra and so on. So this system, the kidneys, bladder, urethra, prostate, is basically what a urologist looks into, right? So, and what are the commonest problems? So both men and women, anything to do with the kidneys would probably be the urologist, especially the surgical aspects. The medical aspects of the kidney can be looked at by a nephrologist, but the surgical aspects will be looked at by the urologist. For instance, kidney cancer, then stones in the kidney stones, bladder stones, ureteric stones, and an infection. So let me give you a quick idea as to what we're doing. So if you take women, especially the women from their 20s to their 40s and 50s, the commonest problem that they come to us is for urinary tract infections, right? So that's something that this is something that's managed by urologists, right? So when let's use this as a small way in which we can disperse some knowledge to people as well regarding UTI. So when when women get urinary tract infections, the commonest misconception is, sir, I went outside and used some other toilet, and that's why I got a urinary tract infection, and so on and so forth. So that's not why people get urinary tract infections. Urinary tract infections come from our own body. So from the body, from the back passage, the infection comes and gets into the bladder. So I'm going to give you 5 tips. When women get urinary tract infection, number one thing that they have to do is drink a lot of water and pass a lot of urine. So because you're trying to flush out the infection, right? So most of the infections come from our back passage. So when we wash ourselves, the direction is always from front to back. So that's how it should be done. Number 3 is undergarment should always be in cotton. And number 4 is if people have difficulty passing stools, constipation or stuff like that, that should be treated. And the final one is very, very useful for women, sexually active women. After intercourse, they should always pass urine and then only go to bed. Because during intercourse, the bacteria is somehow propelled into the bladder, and then it can cause an infection. So that's very common. So if you take women, urinary tract infection is the most common reasons they visit us. And then kidney stones. Men, women, both of them have kidney stones, men more commonly. So these kidney stones are something that causes a lot of pain. So they formed in the kidney, and then they push down in the ureteric tube, and then they come out through the urine. When they're small, they can come out. But when they reach a reasonably big size, 4 millimeter, 5 millimeter, then they can get stuck in the passage and cause a lot of pain. So this pain is one of the most severest pains that you can get, and patients are usually writhing in pain and so on, and that can be very easily treated. Nowadays, we've got tiny cameras that go through the passage, and we can laser the stone and powder the stone and come out. So that's another common infection, common problem that we get. Next, when you take men above the age of 50, a lot of them get problems passing urine, and this is one of the reasons they don't come to us. A lot of people think it's because of age and so on. A part of it is because of age, but a lot of times, when you go to the restroom, when you go to the toilet, it doesn't come out immediately. It takes some time for it to come out, or the speed, which was initially very good when you were younger, is now slowly coming down, and you pass it very close to your legs and so on. So again, frequency, you get up so many times at night, throughout the day you seem to be passing urine, and there's some burning and so on. People are very shy to talk about this, but if they come to us, we can very easily give them a solution. Most of the times, all of this can be managed with medication. So it's not like you really need to, I see this in a lot of patients who come to us. They don't want to bring it out and tell us. Another thing that I usually get is people with blood in the urine. So again, if there's one point that I want people watching this talk to take home is, if there is blood in the urine, they need to immediately see a urologist. Especially in Nambur, people talk about in the Sudu, I didn't drink water, so there was blood in the urine or something like that. But that's not acceptable. Urinary passage can only have urine coming out. If blood comes out, immediately you should come, because I've spoken about urine infections. I gave you an idea about stones. I told you about prostate enlargement causing difficulty in passing urine. But if there's blood in the urine, it can mean cancer. Yes, cancer. So if blood comes in the urine, our goal is to find out where it came from and why did it come. So it can come from kidneys, urethra, bladder, prostate, anywhere. So our goal is to find out where it came from. So and especially smokers, now we've proven that smoking causes cancer. It's written big letters. It's written in the packet. Smoking causes cancer, but a lot of people still do it. I don't know why. So now every time a patient comes to us, so I make it a point to tell them, listen, guys, it's written in the packet. Make sure you read it before you go ahead and smoke. So one of the commonest reasons especially for urologists seeing cancer patients, especially bladder cancer, is smoking. So if at all possible, avoid smoking. And there's this concept called passive smoking. If you're sitting next to a person who's smoking, you probably are inhaling a bit of the smoke as well. So that's not acceptable. So again, passive smoking, don't do that. Don't sit next to a person who's smoking. So that's again important. So this is generally what a urologist would do. So cancers of the kidney, ureter, bladder, prostate, and then big prostates causing difficulty passing urine, kidney stones, urinary tract infections. These are the commonest stuff that we do. And also infertility. A lot of people, men, after marriage are not able to have kids and so on. So if they're having difficulty having children, that's probably something when we would look after that part of it. And erectile dysfunction, that's very commonly seen in this part of the country, especially because we have a hospital, Curie Hospital is in OMR Road. A lot of software engineers come to us. And you asked me about stress in the beginning. I think these young kids in software industry seem to have an amazing amount of stress. I don't know why. Maybe it's their work pressure. Maybe it's difficulty. They have deadlines to meet and so on. So, and a lot of them have this erectile dysfunction. So if they're not able to have erections properly, and so that's something that a urologist would look at as well. So I hope that answers your question.
Yes, I think that was very, very informative,
That's
and
really
thank you for the
interesting.
points. I think the whole point of having Earth is to share this kind of meaning, awareness to our audience. So thank you so much for that.
There are a few people who are asking questions. Why don't you read it out?
Sure. So how can we contact you for appointments from India or abroad?
So you probably need to go to the Curie Hospital website, Chennai Urology and Robotic Institute, and they've got a list of ways in which you can contact us. I would direct you to that website, and the teleconsultation is available as well. So you probably need to go to the Curie website. Are there laws to govern the manufacturing, using, maintaining robots by the government? That's a very nice question. So in India, the robot. So currently in India, how we are working is, if any entity is placed inside the abdomen or stays inside, that needs to be regulated. But if an instrument is used for surgery but it doesn't stay inside, it's not that regulated. So a lot of organizations, hospitals, for instance, robotic companies are starting out by putting their robots here in India. But the current robot that is available at present has been there for 20 years now, and it's gone through various regulations. And most of the robots that are sold are FDA approved, which is the American organizations that's responsible for credentialing or going through the robot's specifications to make sure that it's safe to use. So most of the robots that are FDA approved are currently being sold in India. So I don't think there's a worry in that. But the government is introducing a new bill or law, and it's probably coming next year, so that India itself can regulate the robots within the country.
That's interesting. We do have few audience. They're actually sharing their medical records with us live right now, but we are not going to share that for on the public forum. So apologize to the audience who are sharing your public records. Please do not do that. We do not recommend that. So one of the other important topics that we wanted to touch upon was prostate cancer. And cancer is a very deadly silent killer, and we ourselves had very close relatives passing away very suddenly in a short span of time because of cancer. So the awareness of prostate cancer, I know you're doing a lot of significant work around that. You set up a foundation. Could you share some insights for the audience, like on what is this thing, and what is the awareness you're creating in the work of your foundation?
Very good question. So what is this thing, Kettingal? Yeah, what is cancer? So basically, in our body, we've got billions of cells in our body. So usually what happens, these cells, they're born, they multiply, divide, and then they finally die. Okay, the cells. So if a cell forgets how to die and it constantly multiplies, and that's what is basically cancer. If a single cell forgets how to die and it's continuously multiplying, and it can't stay in one area, it probably needs to go to different areas and takes over the body finally. So that is cancer, number one. Number two is prostate cancer, cancer arising in the prostate, which is an organ present in our body. It probably straddles the urethra behind the bladder and is very, very common cancer that happens in men. Above the age of 60, most of the men probably have some enlargement of the prostate, and then potential for prostate cancer is there. And what are the symptoms? Number one is, I told you, difficulty passing urine, frequency, urgency, and then blood in the urine, and burning, and so on. All of this probably points out to some problem in the prostate, which can potentially be prostate cancer as well. Can we find out early whether a person has prostate cancer? Yes. There's a blood test called the prostate specific antigen, right? And this blood test has the potential to tell us whether a person has having cancer prostate or not. And I would advise anybody above the age of 45 to 50, every year you should get a PSA test done. So I was practicing in America for about 4 years, learning robotic surgery and so on. And one of the biggest things that I found out there is, if 100 people walk into a clinic, 80 people had prostate cancer at a curable state. Now, especially when you talk about cancer, if it is only in that organ of origin, so for instance, prostate cancer only in the prostate, it is more or less curable. So kidney cancer only in the kidney is curable. But if the cancer goes to other organs beyond the prostate or organs beyond the kidney or something like that, then it becomes very difficult to cure. So if we detect it early, then it's curable. So this is something that I want to project. Cancer detected early is more or less curable, especially prostate cancer, kidney cancer. All of this is early detection is curable. So this PSA test, prostate specific antigen helps us detect the cancer early. So what was the difference between America, where I was practicing, where 80% of people who came in had curable cancer, versus when I came back to India, we had, for 100 people with prostate cancer saw me, 80% of cancer was not in the curable state. So all of them had cancer that had spread to different parts of the body. So they came late to us. That was the reason why it had spread. So the same surgeon, the same robot, the same technology, same skill set available in India, but we're not able to help that many people. And what was the difference between the US and here was very simple: awareness. So there's a in Tamil we call it Vizhipunarchi. So in the total lack of awareness regarding what prostate cancer was, or generally what cancer was, because even in masteral checkups, when I came back in 2012, until 2012, people were not doing this PSA test. So, and slowly was getting incorporated in the masteral checkup. So that was one of the biggest challenges we faced, and that was to inculcate this habit even among doctors. So if the patients didn't know that PSA had to be done for detecting prostate cancer, that's we need to work at that. But a significant segment of doctors, we had to push to get the PSA test done, because in India the commonest treatment for prostate cancer was a non-curative treatment was given at those days. They would do orchidectomy, and then people would go back, and then they would live for 5-6 years after that, and then they would die. So in India, at 65, 70 was considered a good age to die those days. Even when I was studying medical college, that was what was. But now people are living longer, and if we don't give them a curative option, we would be cutting short their lifespan. So again, this is one of the biggest challenges. That was why we started the Indian Prostate Cancer Foundation, right? So the goal of the foundation was to prevent needless suffering because of prostate cancer. And like I told you initially, to train doctors, one regarding prostate cancer. Number two is to start the fellowship. This is one of our goals. Now, not only it's important detecting prostate cancer early, but we also have to have the wherewithal to treat them. treat them with the best possible treatment. Robotic surgery alone is not enough. If I alone do robotic surgery is not enough. So we need to have more people doing robotic surgery so that more people are being helped, more patients are being helped. So that was one of the reasons we started the IPCF, to start this awareness. Number two, get in more patients for the treatment and train more doctors to be able to perform robotic surgery so more patients are helped. So that was the goal of the Indian Prostate Cancer Foundation. I hope that answers your question.
Yes, doctor, that does. So I think we have a question. Please discuss your foundation and volunteers of IPCF.
Yes. So the foundation has we've done more than about 1,500 people have had gone through our robotic surgery program with prostate malignancies and so on. So we run a support group for the patient. So as soon as the patient hears the word cancer, there's a big, the family is around them, and then the cancer word has such a bad connotation that people who've gone through the program, who had a good outcome, if they're around them and if they talk to those patients, it's not only enough if a doctor advises how a patient or how the cancer is going to progress, what are the treatment options, and so on. It's also very important that a patient who's undergone the same procedure or who's undergone the same sort of cancer and come out a survivor, if they talk to them, they'll feel far better. So Indian Prostate Cancer Foundation has Indian Prostate Cancer Support Group. And we've got a lot of volunteers coming into that who've already gone through this progress to advise and handhold patients who've had a new diagnosis of cancer. So that's so every month we used to meet in Curie Hospital. But now because of the pandemic, the support group is not happening. But we're trying to do this in an online manner and so on. So that's something that the foundation does every month.
I think it's wonderful that you don't just focus on the medical treatment, but also the supplemental factors of counseling and the support group, which plays a huge impact on the positivity of the patient and the patient's family around them.
That's a very important point. Positivity, like you said. Huh? So that's the key difference that makes a huge difference. And that's what makes a huge difference in the outcome for the patients. The attitude of the patient is also very important. And our goal is to handhold them throughout the entire process, from the time they get their diagnosis till the time they're completely cured. So that is, it's not just they come in, they get the surgery done, they go out. But overall, not only the person or the patient, but also the caregivers. The family, immediate family, they have to be taken care of. In Curie Hospital, we also run this Dementia Care Foundation. That's a pet project of my wife, where dementia patients who come into the, we're diagnosed, brought into the hospital from morning to evening, they're engaged. A neuropsychiatrist evaluates them. And then we look after them from morning to evening and send them home. So for little children, you have this kindergarten creche where they come in and the parents, when they go to work, they leave them and go. But these dementia patients are like that. So they're like children. They forget, they don't remember what they've done and so on. So dementia is a disease that, more than affecting the patient, affects the caregivers. So we have to look after the caregivers and the patients. When the patients are with us for a while, it's a little bit of a respite for the caregivers. So that's one of the pet projects of Curie Hospital, that's run by my wife, Gayatri Ananthakrishnan. But I'm so proud of that project because though it doesn't align with our primary goal of urology, but I think that project alone has such a huge beneficial advantage to the people who make use of it. So again, that's something that we're very proud of.
That's wonderful. And these urology-related issues, are they mostly, I know you mentioned like above 60 years for men, but do children also have this? Is there like a pediatric issue as well?
We also look after pediatric urology patients. And, those sort of patients are usually, it's a congenital problems that they have. So they're born with certain difficulties, certain malformation, anomalies, and so on. That can be corrected very easily with the available technology. A lot of that is found out in antenatal scanning nowadays, and they have potential to correct them, so we follow them up regularly, and then if it needs correction, we can take them up for correction. But some of them, because we've got patients from all over, a lot of them haven't had antenatal scanning and so on, and they're coming from other states. Tamil Nadu is very good at this antenatal treatment, and antenatal mothers are looked after very well in Tamil Nadu. But a lot of people coming from other states, probably children, they've not had scanning, and they come with a lot of anomalies that needs to be looked into.
Wonderful. And I mean, so I'm a young parent. I have a daughter who's 5 years old. But like, is there like any points that you would give parents, like younger parents? What should we look out for in our children, boys and girls?
So I think very simple. You get this question a lot. How much water should we drink? So for adults, it's very simple. So every day when you pass water, when you pass urine, the color of urine should be the color of champagne, or clear, very clear. It shouldn't be very dark yellow, which means it's concentrated urine. So the color should be very, very light yellow, champagne colored, or probably watercolor. If that is the case, then you're drinking adequate amount of water. So it depends. If somebody is working out in the sun for 6 hours, 7 hours a day, their water intake needs to be very high. Because it's sweating and so on. But if somebody is working in a software industry, sitting in an AC room from morning to evening, they don't probably need that level of water intake. So again, it's for each individual, and the best way to assess is the color of the urine that you're producing. Children, again, is very simple, basic hygiene. A lot of people that I talk to, in especially young kids, they don't bring the foreskin down and wash the penis. So that's something that we should teach as parents. We should teach young kids that we should bring the foreskin down and wash it, how much ever it allows. So bring it, wash it, and push it back in again. So that's a very important thing to teach young children. Girls, I find young girls are usually, they try and have this thing where they don't pass urine often. They would kind of control it for long periods of time, and then that in turn has a potential to trouble them at a future date. So if you have the urge, within reasonable limits, go and pass urine as soon as possible, right? So I've been talking about myself and my thing all this time, but I should also talk about you guys. So initially I didn't. The first time I heard about Ghantasala sir was I'm part of the Rotary Club of Madras East, and there's our Rotarian Mr. Surendra is there, Rotarian Surendra, and his wife is Shanti, which is probably who's Mr. Ghantasala sir's daughter. So once we were in a tour in Kashmir, and there's this Shanti madam was singing amazingly well. I did not even have a clue that she was Ghantasala's daughter and so on. So I was like, எப்படி இவ்வளவு நல்லா பாடுறீங்க நீங்க அப்படின்னு. And she and everybody looked at me saying, you didn't know? So I didn't know she was Ghantasala's daughter, and that was my first introduction. I've always listened to his songs. There's one song, Aha in Benilavanile. That was an amazingly good. I used to kind of be humming that song all the time, but only now I realized that it was sung by him. So I read up a little bit about him. He passed away in 1974, and I was born only in 1975. So, but it's such an honor to be part of this talk show, especially such illustrious person, and your family members are taking it to the next level. So it's amazing to be part of this program. And I looked at all the previous some of your previous interviews and so on, especially Dr. Sivagadaksham. So he spoke to me a couple of days ago and said, "Hey Anant, I think you are doing this interview very good, Ravinder sir." So uh, anyway, thank you so much for this opportunity. I must thank you, and Madam Parvati, Madam, I saw her
We-
in that taught my neighbor's daughter, and I came for the Arrangetram. It's such a nice program that you've done. So you are teaching more people than I am at.
Thank you.
I've got 2 or 3 fellows I'm teaching every day, but you're teaching a school of people. Huh? Amazing, madam. Amazing. Huh?
I met you. I met you in Inner Wheel conversation. So I was so
Yes.
impressed. I really wanted you to come to Kala Pradashni. And we have lots of friends like Roja, Kandeya, Murli, all my dancers. Padmini Doraraj is your
Yeah.
relative. So many
Yes.
of them are watching our show. Thank you very much, viewers. We are very, very happy to meet you, Doctor.
Thank you,
So
madam.
your
Thank you.
advice, we will definitely take it up. I hope all the viewers also will. It's very interesting. It's very interesting and informative too. Thank you very much for being with Ghantasalas.
My pleasure.
And we'll all meet you next November 1st with another eminent personality. Thank you very much.
Thank you.
Any questions?
No, I think we've covered all the questions right now. So thank you so much, Doctor, for also answering our audience's questions. Thank you so much.
Thank you. Thank you.
Thank you, Doctor. Thank you. Thank you so much.